Okay, well, thank you and good morning, and I sure appreciate everybody coming out for our press conference this morning about COVID-19, better known as the coronavirus. And we have a number of people that are here today and a number of community folks that are representing as well today. Councilmember Kasachak is here with us, and Councilmember Fimbres, our wonderful mayor is here with us as well. And of course, we have the superintendent of schools as well, Dustin, excuse me. Along with a lot of public safety officials and other folks involved in healthcare. So I think Secretary Sabilla said it best this morning when she said, you know, now's the time for politicians to be kind of quiet and listens to the science guys. And so that in part is what we're up to this morning, and making sure that we have good quality of information out for everybody today. So I especially want to thank Mayor Romero for being here with me today. But I'm going to read a statement. She's going to read a short statement. Then we're going to go to Dr. Garcia and Dr. Anglin, and then we'll be willing to answer any questions y'all might have. With the announcement in Pima County last week of 3 related cases with no travel history, certainly community transmission of the disease in Arizona, that means it's only a matter of time before it's here. So what should we do in the meantime? Take the steps you need to keep yourself and your family as healthy as you can. Wash your hands a lot. Make sure your little ones do too. My wife has been on my case every time I get near the bathroom to wash my hands. So stay home from work, school, or other public settings if you're sick. Here in Pima County government, we're strongly encouraging our employees to stay home if they are ill, and we've loosened up our policies for telecommuting. So if one of our employees has a child who is sick with the virus and they need to stay home with their young one so they don't have to go to school and potentially expose other children, we're going to let that employee work from home if possible while their child recovers. That's just common sense. I'm going to say that again. That's just common sense, and we encourage all our regional employers to adopt similar policies. We also need to protect our elders and others who may be infirmed and suffering from chronic disease. The vast majority of healthy people will get through this just like we're going to get through the flu season. But our elders and those who are ill are the ones who will have the most serious consequences of the infection. Our community needs to know that this isn't something that's going to come and go. It's not going to be here for a little while and then go away. We're going to be dealing with this illness for some time until it runs its course. So let's not panic about it or do things that are detrimental to our lives, our culture, and our economy that won't help in the long run, halt, or slow the spread of this disease. So wash your hands, don't touch your face, and that's harder to do than most of us think, huh? But do your best to stay home when you're sick and stay informed. Our incredible Pima County Health Department has excellent, informative, and comprehensive webpage with everything you need to know about the virus and how to protect yourselves and your families. It's www.pima.gov/COVID-19. The health department is keeping it up to date every day, and not every hour when things are moving, and maybe every hour when things are moving fast. It's where I get the information that I need for myself and my family and my staff and for constituents, and it's where you should go for reliable and accurate information about COVID-19 in Pima County. I want to thank Drs. Garcias and Anglin for the great leadership getting us prepared for this outbreak and keeping us informed. And I want to thank all the people at Pima County Health Department who have practically been working day and night over the past 2 months getting ready for this day, and that comes with the virus and when the virus comes to our community. So yes, we have been working at it diligently for the last 2 months, and so I'll also introduce my friend Mayor Regina Romero, please.
Thank you, Chairman Elias. And thank you everyone for being here today. One of the things that I had called Chairman Elias on Friday is that it is important for the City of Tucson and Pima County to work closely We have been working very closely, and I felt very strongly that it was time to inform the community of the work that has been happening. I know for a fact that we have other partners here with us today. El Rio is here, TMC is here, as well as the City of Tucson. I see a representative of the University of Arizona. And of course, police and fire and 911 operations directors are here, as well as my colleagues on the council, Dr. Trujillo from TUSD, and many other partners in the community. We're here to discuss actions being taken by Pima County, the City of Tucson, and other local jurisdictions to prepare for the presence of COVID-19, minimize its impact on local government operations and services, and keep our city healthy. We are actively working with local, state, and federal partners to monitor and prepare for the presence of COVID-19 in Pima County. Thank you, Chairman Elias, for your leadership, the Pima County Health Department, and all our local partners that have been working diligently on this effort. My office is also working closely with local partners to ensure that we are prepared as we can, not only as a City of Tucson government, but also City of Tucson residents. I want to emphasize that both county and city have protocols in place to deal with exactly this kind of situation and are fully prepared and are ready to respond when the virus presents itself in our region. To date, no cases have been confirmed in Pima County. However, we do expect and are fully prepared for the virus' eventual presence in our region. As with other illnesses, sticking to the basics can always go a long way. And Chairman Elias just mentioned washing your hands constantly, covering your cough, and staying home if you're not feeling well will keep yourself and those around you healthy. We are taking the issue seriously, and we will continue working with our local partners to monitor the situation. We are taking every precaution necessary in the City of Tucson and in Pima County. I'm speaking to you not just as the mayor of the City of Tucson, but as a mother of 2 children attending our public schools. My top priority will always be to maintain our community's public health and ensure that everyone in this community has the information and resources to keep them and their loved ones healthy. Thank you so much again, Chairman Elias, and I'll turn it over to you to introduce our next speaker.
Thank you very much. Okay, common sense again, washing your hands, make sure your little ones do that. Keep your hands away from your face. Stay home if you're sick. Watch out for your elders. Let me repeat that one. Watch out for our elders. It's people with chronic health conditions that are at most risk, so we definitely want to protect those that are most vulnerable. And stay informed. So without any further ado, I'm going to introduce our Chief Medical Officer, Dr. Francisco Garcia. Dr. Garcia, if you'd please come and take the podium.
Thank you, Chairman Elias. Thank you, Mayor Romero. We appreciate the opportunity to be here before you today. I'm going to ask our healthcare sector partners to come up to the area to also be recognized, please. Let me just say that this Friday and Saturday, when the state identified 3 confirmed cases of COVID-19 in Pinal County, it really set off a chain of events that really are indicative of community-wide transmission. These individuals do not appear to have any significant travel history, nor do they appear to have been in contact with someone who was a confirmed case. So this puts us into a new phase of the response, a much more forward-leaning phase of the response, and that's what we're here to talk about. Before the Gem Show, we started having very deep conversations with the City of Tucson, as well as other jurisdictional partners, about how to maintain the health and safety of this community, as we were expecting to have all these visitors and all these crowds in our various venues. Those conversations produced a very safe event without any without any bad experiences for either exhibitors or participants. And that's what we're hoping for us as we move forward. So back in February, we stood up the virtual health emergency operations command under the leadership of our Deputy Director, Paula Mandel, as a way of being able to streamline our communication both with the state and with the feds. We've been on almost daily communication with our federal partners because this is a rapidly evolving situation. As we move into this new phase of the response, however, I want you to think about three things that are our most important messages. Number one, this is the time to optimize your health and the health of your family. People who are healthy get over this virus. People who are unhealthy, who are frail, who are elderly, may have a harder time and may have a more serious consequence. It follows from that, number two, that we really need to focus on protecting the vulnerable. And in this case, the vulnerable are the same vulnerable that are impacted every year during the flu season. Those are our elders and medically frail individuals. These folks, elders, medically frail individuals, should probably stay away from crowds. These folks should probably avoid cruise ships and airplanes. These folks need to be cocooned so that we can maintain their health and safety. Finally, as we settle in for a long-term response, we need to make sure that our first responders and our healthcare sector and our emergency personnel are taken care of. And that means having the right kinds of policies in terms of the ability to stay home when you're sick, to protect your own health, as well as the same kinds of HR policies, the same kinds of infection control policies that will decrease the likelihood that breaches in infection control practices could lead toward untoward infections. So I'm going to pass this off to our health director, Dr. Bob England, who is a veteran of another very interesting outbreak back during H1N1.
Thank you, Dr. Garcia. I want to reiterate that we haven't yet found a single case of this testing positive in Pima County yet, but it really doesn't matter because it's going to be here and it's going to transmit locally, and we need to begin treating it in that way as if we're expecting it. This is probably going to feel to us like a bad flu season. So just as we lose tens of thousands of Americans each and every year to the flu, this will tragically kill many people. There's no getting around that, but it's going to be something that we've all experienced every year because we go through the flu season every year. In places where they've been able to test more, however, than we have been yet, they are finding much more mild illness. So in South Korea, for example, where they're doing a lot of testing, the mortality rate is 0.6%, 1/5 of the often quoted figure that you see in the news all the time coming out of some other places. And they're still, I am sure, missing much mild illness. We know that from cruise ship data that asymptomatic infection, no symptoms whatsoever, seem to happen up to perhaps half the time. So that will further decrease that mortality rate down to something that is going to be somewhat in the range of what the flu is. We got a lot to learn, but there are a lot of good indications for us to treat this the same way that we do influenza. So, I cannot foresee a circumstance under which we would close a school, or more to the point, all the schools. That would be terribly disruptive, and the data just doesn't support it. Kids are getting, not just having less severe illness, they're getting infected less often than adults. And where they're getting infected seems to be in households where it's the adults getting sick first, giving it to the kids for the most part. So that's not like the flu. I'm a little surprised by that. but I'll take it, because that makes it possible for us to not even give closing schools a second thought. At this point, we have no plans to cancel any public events either. It's just that people who are at higher risk and know they're at higher risk may wish to not attend those events as frequently or put themselves in a place where they might get exposed as frequently. Certainly not visit someone who's sick. At the same time, all of us, it's on all of us to use common sense measures to protect older adults and those with chronic illness. If you're feeling sick, please don't go visit grandma at that point in time. That won't help. In fact, if you're sick, please stay home. Don't send your kids to school sick. Please don't go to work sick. Do the common sense hygiene that's already been well described, washing your hands, keeping your hands away from your face. And I don't know if I've touched my face since I've been up here, but that's really hard to do. If you ever, when you really pay attention, you find out you're touching your face all the time, so try not to. And importantly, if you have a mild illness, treat it the same way you would have treated it a couple of months ago. You don't need to go seek health care unless you're sick enough that you need health care. So behave just the way you did before. If you have a mild illness, there is no benefit to you for knowing whether it's this virus or one of the many other viruses that are still circulating. And lastly, I'll say that thankfully, private lab testing is right around the corner, which will help us greatly expand our capacity for testing and allow physicians to test patients that they want to test and give us a much better idea of what's really going on in our community. Thank you.
Thank you, Bob. And before we open up the questions, one of the issues is why don't we do what is being done in Italy? Why don't we do what has been done in Hubei and Wuhan province? The impact of essentially closing down our regular lives is so devastating from an economic, from a social, from a health standpoint, that at this point it doesn't make sense for a community like this one to undergo that kind of impact voluntarily. This is not to say that the CDC may not make a recommendation to that effect later on, but at least at this point, from what we can see, we would not recommend taking such draconian measures unless people really are prepared to be hunkered down in their homes, in their apartments, for 3 months at a time. And I don't believe that that's the kind of place that Pima County is. So I'm going to just finish off by saying that on Friday evening, a bunch of, because we know there's so much misinformation, we thought it was important for all the healthcare sector partners to speak with one voice. And on Friday afternoon, the vast majority of our healthcare sector partners and ourselves, our federally qualified community health centers, our hospital partners, our ambulatory care partners, all signed on to a joint statement that essentially reiterated what Bob just said, which is let's be smart about this, let's be alert, but let's not be anxious. We're going to open it up for questions at this time.
Is there any employee or elected official from the city or county being tested for the coronavirus?
We couldn't tell you if that was the case.
Definitely see the emphasis on common sense measures. Is there any concrete protocols or procedures being put into place that are being done differently now in either county or city government?
So I will tell you what we are doing differently currently, and then I will let the chief of the fire department talk about what they're doing and TPD talk about what they're doing. We're trying to make sure that in all our public spaces, in all our places where we have public counters, that we have either access to a bathroom for hand washing or hand sanitizer. And that's really important. We're trying to make sure that there is good messaging and good signage that talks about the kinds of normal respiratory precautions, covering your cough, for instance. We're trying to make sure that that signage is available and abundant. Our hospital partners, our healthcare sector partners, in their particular venues are doubling down on their infection control practices. This has been a really good opportunity for all of us to exercise that muscle. And I'm really proud to say that all our healthcare institutions are really taking this as a learning opportunity. Chief, do you want to comment on what TFDs do?
You might want to mention staying home from work.
Oh, and staying home from work. Well, that was one of the first things that we talked about was HR policies, right? So our HR policies have to be permissive so that people do not feel like they will be penalized if they are staying home when they are ill.
So on behalf of the Tucson Fire Department, the precautions and measures we're taking, our men and women are taking, are really no different to what Dr. Garcia alluded to during a normal influenza season. They're equipped with the proper PPE to manage sick patients, and we encounter sick patients many times every day in this city. We're following the recommendations of public health officials and the CDC guidelines for EMS workers and healthcare workers, but beyond that, it is business as usual for Tucson Fire.
Other questions?
The next big event in Tucson is going to be the Festival of Books, something like 100,000 people coming to this. Obviously, no one's announcing that it's closed, but are there any changes to the way the festival is going to be held in order to take account for the coronavirus?
I'm going to turn it over to one of the folks who's part of that organizing committee, but I can tell you that we have made no recommendation that on the basis of a public health concern that festival be curtailed. We have made the suggestion that, number one, the frail elderly, the medically vulnerable stay away from a large group gathering like this. We have made the recommendation that adequate access to hand sanitizer and to hand washing stations be available. We also have made the recommendation that signage be placed prominently so that folks can know how they can protect themselves. And in fact, and Bob doesn't know this yet, I volunteered the health department to have a table there to answer questions.
Sure.
Julia, do you want to make any? Okay.
Great. You mentioned the HR policies, making sure they were permissive. All of you up there represent a pretty large chunk of workers in Pima County and Tucson. Are there plans being formed if a large group of your workforce suddenly starts taking off?
Well, certainly, and I'll let the city talk about what the city's doing. Certainly, across the county, we are dusting off our continuity of operation plans. Again, this is a really great opportunity for us to make sure that we actually have functional plans. What happens should a significant percentage of our workforce be unavailable? We're revisiting our telecommuting policies. We're revisiting our HR, sick leave policies. We need to sort of prepare to continue to do business even as we adapt.
Last time I checked, there were 79 people that were tested in Pima County. Is that number still?
I can't tell you the exact number. I think it's in the neighborhood of about 120 people that we've evaluated. Vast majority of those don't get tested because the testing criteria is so narrow. To date, because the state of Arizona had a very limited supply of tests, and it's the same story around the country, the criteria to get tested focuses on people who are really sick or have a real direct known connection. That skews us to making it look like everybody's getting really sick. And that's really not the case. And the more we get into this, the more we're going to see that really mild infection is the vast, vast majority of cases.
And Jasmine, just to sort of embellish on that, just to be clear, The only testing capacity currently in the state of Arizona for COVID-19 is at the State Public Health Lab. That is up in Phoenix under the control of ADHS. They are following the guidelines of the CDC in terms of accepting specimens for actual processing. We are about potentially to have the availability of private lab companies like LabCorp and Quest have that testing availability. That is about to happen early this week, may have already happened this morning.
Yeah, I will say, double-edged sword to this. The number of people who can get tested will increase, but the turnaround time is going to be a lot longer for the private testing because it has to get shipped out of state. And I'm sure they are going to be very busy very quickly because so many people are anxious about this, especially in communities where community spread is already pretty widespread, like you see in the Seattle area.
Okay, thank you. Oh, I got one more. We'll go ahead and take it.
We reached out to a couple of the shelters working with Tucson, Pima County homeless population, and one of them had told us, we're waiting for Wednesday for direction, but they didn't specify whether that was coming from the health departments or the city or county. Is anyone up there working with these groups or kind of helping direct any sort of changes they make?
So, you know, we work with all the shelter operators because we license their kitchens, because we do inspections of their facilities every day. We have, I know that Councilman Kozalczyk and other folks are hosting meetings of stakeholders, which include folks from the shelters, to talk about the kinds of questions that they may have specifically.
I know that we have had discussions with multiple shelters already who have called us, but this will be a way through the councilman to be able to more directly answer individuals' questions. Would you like to speak to?
If I'd like to.
Sure.
We've also requested this morning, as a matter of fact, to consider, to the city manager, to consider hand washing stations in the area of downtown and areas where we feel are necessary to have additional hand washing stations and opportunities and antibacterial stations to go and walk into recreation centers, city hall, and other planning and development services and other departments that have a lot of people coming in. So we're taking those additional precautions, and we'll continue making sure that we are all council offices, the mayor's office, and Pima County, all of us, talking as to how to address the specific needs of our houseless community.
Go right ahead.
Craig, this conversation started a few weeks ago when the city manager and my staff toured Sister Jose's. We have a direct relationship with Jean Fedigan, who runs the place. And some of her questions were along the lines of, we, Sister Jose's, and other homeless shelters already deal with a medically compromised population. And we're in enclosed facilities, oftentimes not with the best sanitation amenities within the facility. And so her question was, what do we do if one of our clients shows up off the street some night and is exhibiting some health care issues? What are the protocols? Do we transport them to TMC, to Banner? Do we house them in the facility? Do we quarantine? What do we do? And so there were those concerns. We've also had a long-term relationship with the Casa Alitas group, with the starting at the Benedictine Monastery and now out at the county facility. And so some of the questions with that group, Catholic Community Services, were, again, we're seeing this population who may arrive at our place medically compromised. What protocols are in place? Oddly enough, though, we also had some phone calls from people such as the manager of one of the local shopping malls. What happens in a large gathering here if somebody's walking into our facility? And so what we have done is we've asked Dr. Garcia's office to come on Wednesday. In addition to that, TMC will be there and El Rio Health Center will be there. you'll hear a lot of the same kinds of things that you heard here, but what we're interested in are what are the kinds of questions that we're going to get from that group of shelter operators in shopping malls or whatever. The questions you'll get from the maintenance guy at Primavera are going to be far different than the questions that you get from the manager at Park Mall. And so we're interested in hearing the questions they have because it may help to better inform the responses that we make. So that's.
The only thing I was going to add is that a number of special facilities will have their own sets of questions that we haven't covered in this yet. But the bottom line takeaway for all of them is, what would you do during a really bad flu season? It's very similar kind of steps.
A question for our elected officials. We've heard the news of some elected officials coming in contact with people with coronavirus. We think elected officials are out in the community, shaking hands. Are you, in your offices, doing anything different as far as travel or community engagement?
I can only speak for my own office, but we're not doing anything different. We're still engaging the public because that's our job. We're going to continue to do our job, and as long as I'm healthy and the folks that we're dealing with are healthy, it's all fine, and that's the correct thing to do.
And what I could say is the mayor's office is in close communication with the city manager's office, making sure that we internally to all city employees encourage people to stay home if they feel sick. I myself got sick with the flu last week, and at the first signs of infection, I just had to stay home. And so encouraging all of our employees that if they feel something coming on, just to stay home and visit the doctor if it is flu-like symptoms, to make sure that they get tested at least for influenza. So same thing, have Lysol wipes at the office, make sure that we wash our hands, especially elected officials, that we encounter a lot of people, and we're doing, the COVID-19 elbow tap to say hello to people, or just so it's really important that we encourage my staff, all of the staff in the city of Tucson, to stay home, and encourage managers to send their people back home if they see that they might have flu-like symptoms.
Okay, thank you very much for attending. Everyone will be available for individual interviews following the event. Again, thank you all, and special thanks to County Administrator Chuck Huckleberry and his staff for working hard on this, and City Manager Michael Ortega for being here and helping us constantly to work together. So thank you all very much.